Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is Dino DiBernardi with Chief of Emergency Services. Welcome, Dino.
Thank you for having us. Good morning.
Dino, we are standing in front of something new for emergency services. Tell us about it.
All right, so with the American Rescue Plan Act, Caldwell County was able to purchase an ambulance bus. It's a multi-patient vehicle that we use for mass care. There's some multifaceted uses. We're able to use it for major incidents, for mass casualties, for example. We're able to use it as a mobile clinic for vaccine rollout, whether that be for flu, COVID vaccines, or otherwise. And we're also able to use it for infusions, for the COVID-19 infusions. And then also, the primary use was, the bus is able to handle multiple patients, and the hospitals have been inundated with patients over the past couple years throughout the pandemic, and we're able to use this as a drop-off point to keep our ambulances in service. So this unit could actually be at the hospital, and I know we'll go over that a little more in depth later, but the ambulances are able to drop off patients here, still receive care without being held up at the hospital for lengthy periods of time.
So a multi-use vehicle, besides the hospital, where could people expect to see this?
So you'll see it at any major event. So if there are multi-car accidents, major fires, it can be used for fire incident rehab. It'll be a mobile clinic, so they'll actually see it out in their communities where you can come by, get your blood pressure taken, blood glucose taken, cardiac screenings, things of that nature. You'll see it at large-scale sporting events, big. Anytime there's a lot of people, so it could be festivals, even utilizing it at concerts and events of that sort. And then obviously, yes, at the hospitals, any clinics throughout the community, and then also throughout the state. The state has already reached out to us about using it for deployments, for natural disasters and things of that sort. So it really will be it could be used for a wide array of things. And one of the biggest perks is, although yes, it is purchased with taxpayer money, the federal taxes, no local dollars were used to purchase this. So the county's getting the benefit of this, and really the region and the state, without having to be a burden on the local taxpayers.
All right, thank you, Dino. Let's take a look inside. Dino, explain this setup to us.
So one of the added benefits of the ambulance bus, as it's called, is you can reconfigure the entire unit. So although yes, it can be used to transport as far as backboard or lying down patients, it can be used to transport up to 7. It can also be used for mass evacuations or movement of patients that are in wheelchairs, and you can handle up to 10 wheelchairs between the sides of the unit or the center aisle. And then it can also be used as clinics. So for example, if we're going to be doing infusions or vaccinations or anything of that sort, any type of evaluation on patients, we could utilize just the front of the bus, or we could utilize portions of the rear of the bus. And all of this is removable as well. So if you needed to do a mass evacuation or needed more space for just seated patients, you can take out all of these stretchers or gurneys, as they're called, and they collapse down. They become very compact, and then all of this stuff can be moved and reorganize the area for better utilization. So for example, this unit, primarily for us within the pandemic, was purchased to be able to lessen the load and strain on the pre-hospital providers as far as keeping ambulances in service at the hospital. Our hospital's been great about working with us, but at times the emergency departments become overrun. So we can move this unit up to the hospital, and ambulances can drop off patients to the ambulance bus rather than being held in the hospital because of ED bed delays, which sometimes have exceeded 3.5 hours. So while we're there, and when we're in the community doing clinics, we can provide COVID testing, we can provide treatment, transport, and care, and then we can also just continually evaluate those patients. If we want to change from that dynamic into an emergency scene, this unit will roll on any major fire, any major motor vehicle accidents, or large-scale incidents, or God forbid we ever have an active shooter situation. It's able to handle a large number of patients at once. And the perk for a bus of this size is the maneuverability. We have a lot of narrow roads, smaller access areas, but also with our hospitals not being able to handle a huge influx of patients at a time, we would only be bringing in, approximately at the most 7 to 8 patients with this unit at a time, which is much more manageable on the hospital side. And then when you change gears a little bit more and you go into the community clinics, you could go out to communities, and we already are working with a lot of community groups and organizations, to where we'll go out into different areas of the county, especially for the underserved or the more distant areas that don't have a lot of access to primary care, and we'll be able to do blood pressure checks, vital sign checks, glucose checks. We'll be able to give you a full cardiac screen. We can do blood draws, real telehealth and telemedicine. And then with our new medical director and our prior medical director, who's now become our deputy medical director, we're going to actually be able to bring healthcare to you. So that mobile integrated healthcare, in conjunction with our community paramedic program and the health department, will literally bring the county's clinic, the community paramedic, and then the hospital itself out into the community. So it really is a multifaceted vehicle that can do a lot of different things.
A great addition to our county, and you will be working closely with the health department and your community paramedics team.
It is, and I know that we'll be talking with them here in a minute, but the health department's been instrumental with this. The hospital has been great. They understand the strain that has been in the clinical setting, that obviously the domino effect that it has on the pre-hospital side. And then honestly, there's been a lot more community groups and organizations and departments within the county. The sheriff's department's going to really benefit from this. We can use this as a mobile command post, for example. They'll be able to use that to get people in, even the fire departments, whether that be for fire incident scene rehab for firefighters, or when, if if your house ever does catch on fire and there's inclement weather outside, we would be able to get you in out of those elements. So whether it's the heat in the summer or the cold in the winter, or that's rain, snow, anything in between, it gives you a place to come in. So being able to work with all of the different community groups and organizations, not just county government or the municipalities, has really been an added benefit to this bus. And I think being able to have the small footprint and not having that strain of the cost, coming out of general budget, it's really going to be a beneficial aspect to not just Caldwell County, but the region and the state altogether.
And when you say small footprint, can you give us an example of the size? Without giving measurements.
Yeah, absolutely. This bus is similar to any church bus or small bus that you would see at maybe a community college or something of that sort. Many times ambulance buses are the large buses. You have the Bluebird buses where that's a Freightliner International or something chassis where you're carrying 20 or more patients at a time. We needed something as an intermediate option, and there's not been a lot of these made up till now. The company that we did, First Line Technology, out of Chantilly, Virginia, that we purchased this through. This is the first small frame bus of this sort that they have built. Since then, they've got multiple organizations wanting to pattern buses out of this to be able to transport small number, but from incidents that would normally overwhelm the number of ambulances or transport units on scene. And then being able to have that small frame just gets you into certain areas. We cannot take up a lot of area at a festival, for example, to do community outreach. We can take up a very small footprint of an area at a church, or if there's a community event at the local rec center, we would just have a very small area that we'd have to take up. And then we can also accomplish that the disability patients, where if you're in a wheelchair, and you will see soon, the ramp that comes up on the back. So it accomplishes all the goals that we were wanting to do. It met all the metrics for the American Rescue Plan Act for response to and mitigation of COVID-19 pandemic. But its benefits expand much beyond and extend much beyond the pandemic itself. This unit will not be used heavily to where the strain on the chassis would make it need to be replaced soon. So the benefits that you're going to see are going to be over many years and to a lot of different facets of the community. I really think you're going to see a lot of benefits to multiple groups within the community, not just those that need immediate health care.
Thank you, Dino. Now I have joining me Anna Martin, Public Health Director for Caldwell County. Welcome, Anna.
Well, thank you, Paige.
Anna, from a health department perspective, how do you envision using this bus?
So with the bus, we plan on doing vaccinations, whether it be COVID vaccinations, flu vaccinations, any type of vaccinations. But right now we're focusing on COVID, of course. And then also we can do COVID testing and also any type of other clinics.
Now, you have been taking testing and vaccinations to the community for a while now. So, how will this enhance that effort?
We would basically have the lab and clinic in the bus, besides just in a little bag in our car and then taking it back and then sending them off or running the test at the health department, and people wouldn't have to wait. So this would help a lot, that people would get their results on scene, things like that.
Talk to me a little bit about COVID vaccinations and where we are with that, and also, again, how the bus will help with that effort.
So right now our COVID vaccines are a little bit lower. We're hoping to pick it back up, but if we can go into other communities, we're hoping to get people on the bus and given their vaccines that can actually wait inside the bus. In the past, they've had to either wait in their cars or just wait outside, but we have enough space in here where they can actually wait their 15 minutes before leaving. So we'll be able to take it to different parts of the county where we're not able to do that right now.
And with most of the vaccines, it's a 2-dose vaccine, so you would come back in the allotted time period so that they could get that second shot?
Right. We would be able to do that. We can do that, or they can make a schedule with the health department to come back here, whichever suits them better.
Thank you, Anna. How will community paramedics use this bus?
Sure. The community paramedics, what we're able to do is transition the usage of our tent here into the ambu bus. So we'll be able to have a controlled environment as well for our COVID mitigation side. Along with that, we'll also be able to take this, it's mobile, so we can go just about anywhere. We'll use it for outreach to go out into the community. Large-scale events we'll be able to go to. Hopefully when we start to have larger festivals and such, on the EMS side, we'll be able to come and staff it as well. In collaboration with the health department, we'll be able to go out and have our paramedics on scene, as well as the nurses from the health department. Again, COVID mitigation or any type of event that we can both help and assist with.
Jason, would you tell us about the mobile integrated health piece and how that fits in with this bus?
Absolutely. So one of the concepts and ideas with having an apparatus like this is the idea of following along with mobile integrated health. That falls right along with community paramedicine. Our ultimate goal and idea is, to get out and to have that patient-centered approach. So not only having us as paramedics, front lines, boots on the ground, but also to have nurses along with us, mid-level practitioners if we're able to accomplish that, nurse practitioners or even physician assistants down the road. We do have two fantastic medical directors, Dr. McClinton and Dr. Garrett Snyder, coming on board with us. So there's the idea and the potential that we could very easily take this out and not only have a paramedic or a nurse here, but to have a physician as well to be able to treat and help folks. So again, the concept is to go out and meet those folks, not to have them come to you.
So very exciting, lots of new uses, lots of new ways to deliver medicine. It's the same care, it's just delivered in a little bit different way.
Absolutely, yes. We're taking what we're able to do, on the 911 operations side, an ambulance is a paramedic's office. Our office has gotten bigger. We're able to do more. We're able to introduce more folks into it as well. Having a physician on an ambulance is generally not something that we see, but here we would be able to do that.
Jason, have I forgotten anything?
Well, the idea not just with the mobile integrated side, but or community paramedicine, but this is going to be, it's for emergency services, so EMS. So our primary goal is to respond to 911 calls. Heaven forbid, in large scale events, active shooters, weapons of mass destruction, things like that, large scale structure fires, any type of event that happens that we respond to, this apparatus will be able to go to. Obviously we'll be staffed with paramedics, and like I said, potentially, depending on how long the scale of the event goes on, maybe even physicians as well. So we'll have this in our wheelhouse to be able to, treat many, many patients.
Jason, thank you for joining us today.
Thank you, Paige.